8600 to participate. Please understand that the views and opinions expressed by the participants of the program are not necessarily those of the management, employees, or advertisers of this radio station. And now it's time to find out what's in store for us today. From Dr. Dan Drehas, Dr. Dan the Animal Man, brought to you by the Riverside Animal Hospital in Muscatine.
Good morning, Muscatine and the surrounding areas. This is Dr. Dan Drehas, Dr. Dan the Animal Man, coming to you from Riverside Animal Hospital here in Muscatine. As chronic active listeners, there's a little diagnosis. Chronic active listeners, not acute. And if you're an acute listener, meaning just today, the facets of Dr. Dan with the Animal Emergency Center of the Quad Cities, which is always an entertaining topic. And, of course, school starting here at Muscatine Community College, the Vet Tech program. So if you have any questions about any of those, there's always a good thing to call it 263-8600. And I'm glad I finally bathed this morning, because with these new cameras, as I'm looking into it, make sure I don't have any grease in my hair. So getting ready for your football season, so that's cool. Oh, yeah. All kinds of new things happening here. And with these new cameras, it's almost like close-up magic. You see, I brought nothing with me except for my phone, because I was going to look up something and actually did on the way in here, because it's kind of a free-for-all. I've had a couple of those where I don't really have a specific topic. I have a bunch of little teeny ones. So if you have any questions as I trigger something off, or, again, nothing related. Mm-hmm. Last time we had a gentleman call about dog food, which I thought was great. Mm-hmm. And someday I'll have a topic on nutrition.
That was an interesting topic.
Yeah.
Thinking about dog food.
It's a very in-depth one, because I'm not a nutritionist.
Mm-hmm.
I know enough as the veterinarian aspect of that, but I'm definitely not a nutritionist. But I could certainly give a lot of good recommendations from the veterinarian side. But launching today, I got some great news for all you online people, because this day and age with Amazon.com, PetMed Express, you name it, all these .com sales and non-brick and mortar stores. There's a lot of online shoppers these days. And yes, at veterinary clinics, we always have that little bit of a when somebody says, "Oh, we're going to get our flea and tick online, or we're going to get something online," or we get a request for a script for something online. So it's, we try to be competitive with the pricing online, and I say this for all brick and mortar vet hospitals. Mm-hmm. It's been a difficult thing for us to do, because and we like to at least let you guys know, how come you can't match price with the online stores? And well, online stores, they just have a machine, grab it and send it off, versus we have to have staff, we have to have space in our things, and the cost to carry our own in-house pharmacy is much higher than the big box stores, the PetMed Express. We have to have a veterinarian. We have to answer your questions when you call about how to do this. We have to support it. When you call and say, "Hey, my dog vomited this up, what do? We talk with you. You're not going to get that from your online store. You're not going to get that from PetMed Express, or you name it, Pets R Us, or there's a bunch of them out there.
Pets R Us, is that right?
I don't know.
I'm going to Google that later.
Acme Pet Store, But, they don't have that awesome one-on-one, and I'm not talking about just Riverside Animal Hospital. I'm talking about Muscatine, everybody, where we know your patient. We know what's best. We know that, yes, there's 3 products for this, but knowing your pet, seeing your pet, knowing you, we could tell you which is the best product that's going to work, because generics aren't always the best. The cheapest one is definitely not always the best, and there's a reason we use it, because we trust the company, we see the side effects, we know the side effects, we know your pet and how it's going to work. So we have that involvement. And quite honestly, a lot of the guarantees the manufacturers have for the product won't hold up on a generic pet store, because they don't have a veterinarian. They don't have that valid client-patient relationship where we know what's going on with your pet. The classic one is your heartworm pills. If you buy your heartworm pill online, we use Mariel's. We love the HeartGuard. Most people know that little awesome brown chewy thing that they like, and it's the staple of the industry. You buy it online, you miss your guarantee. So if they do get heartworm disease, they do vomit, they do get sick, There's no money back guarantee. The veterinarians, we've had a rare occasion where a dog has gotten heartworm disease, even been on it, even though it's very, very good product, that the company has paid for the treatment and diagnostics and all that kind of stuff. So they'll back that up. You don't get that from an online store. And so that's a bummer. And quite honestly, as I make a plea for us small practices that are brick and mortar and small businesses in America, we value that income, that relationship we have. Maybe you're saving yourself $5-10, but that $5-10 to help support your veterinarian is great.
And maybe that $5-10 is one less visit because your dog's thrown up or something like that, because you guys can help get them on the right path rather than giving them the.
I've had some weird ironies where I just smile. I had a client just in a while ago, and they came in because they had an injury, and we were fixing it and put bandages on it. And the last bandage they came into, bandage change and visit, I did as a courtesy because the third one I liked them, whatever. And then a week later, I got a request for online so they could save $5 for their online medication. And just like, oh man, it kind of hurts a little bit. I would like that. Yeah, maybe you save yourself $5 or $10, but I did your courtesy stuff. Right. I talked on the phone. I actually came in an emergency for them and that sort of stuff. So, we appreciate that, and it helps keep our client or our staff paid. It pays the bills, stuff like that. So that, $5-10, I can understand if it's a huge amount and the convenience. Now, that being said, Riverside Animal Hospital today is launching their online pharmacy.
Excellent.
We do have, we will have our own through us. Partnered with one of our distributors where, yes, you're actually buying it from Riverside Animal Hospital, but it's online. So that way we can maybe capture some of those people looking around online. If somebody does need some convenience of, we don't have that in stock, we can have them ship it directly to you and stuff like that.
That's just what I wanted to ask. So when you give a prescription, where does someone go to pick up the prescription? Is it from you, or is it from a pharmacy? It's interesting you say that. In fact, that's an awesome question, because I'll tell you how pharmacies and veterinarian practice works, and some people don't realize this. So here's a tidbit for you listeners out there. We have what we call kind of like a limited pharmacy license. We can only stock things to sell for our own clients with our own valid client-patient relationship. Meaning, unlike these other pharmacies where they have, all you got to do is send in a script and they'll send it out to you. That's what humans, they give you a script, you can buy it whatever pharmacy. They have a license to sell to anybody as long as they have a prescription. Veterinarians, we can only sell to our clients. So if, say, I, Joe Blow, I go to Riverside Animal Hospital and I need some drug. Maybe I don't even have it, or maybe they just don't like the price or whatever. They can't go to another vet clinic and say, your price is better, here's my prescription, and buy it from another vet clinic's pharmacy. That's illegal. Really?
We cannot do that. So people come in and say, hey, can I pick up some, you name it, a prescription drug? Now, over-the-counters are different, shampoos and dog foods and stuff like that. But if it is an antibiotic, let's say, or a non-steroidal anti-inflammatory, a pain pill, they say, I just need something to get by. Well, I can't sell it to you until I see your patient. We have to establish that first of all. Gotcha. So it's illegal for us to just sell to somebody over that walks in. But if they come and say, hey, I went to another veterinarian, can I have them call and say, it's okay, but my dog is on this antibiotic? Yeah, great. I still can't sell to you until I see your pet in the door. So I've seen that pet to know that. That's our pharmacy laws. You can't just come in, even if the veterinarian from your regular veterinarian calls and says, yes, they need to have that thyroid pill. Please give it to them. I still can't sell it to them until I actually see that they have that pet. It's part of the DEA license and the pills and the laws and the pharmacy laws. So we can't send them to other store or other vet clinics to pick it up. So it's very limited. We can only sell it to our own clients. Now, by doing online pharmacy, we're using the distributor's pharmacy license, and so maybe somebody we've never seen before. If they want a non-prescription, they can buy it. If they need a prescription, they still need to come in and talk with us first or get a prescription from us. So it just makes it, the reason we decided to do this, one is for a little bit of that, some people just like the convenience. They like shopping online, and we understand that. Some products may be a little bit less expensive buying even online from us, but I'm not having to have my staff get it off the shelf, walk, spend 20 minutes, put our own prescription label on it, use our own dispensing bottles, dispensing bags, all those things, which adds up on cost, the time away from seeing a sick patient. And so that's those costs that we at Riverside Animal Hospital incur that you don't think of just calling in some non-trained stock boy or girl or whatever is just picking it up and sending it off. A lot less expensive for the online pharmacies to do that. Even for us, it's a lot less expensive for us to let just them do that. And so we're going to start that up. In fact, I looked it up on the way in here. The products are on there. It's going to take a week or two to shimmy out some things we won't carry. Most things we will. There are some brands we just are not fans of. Even our distributor that is helping us link this online pharmacy, they have way more products than we would have in our office. So we only want to do specific product lines because I personally, Dr. Dan, I'm not a big fan of.
So this is a way for you guys to kind of help. Not only does it really help if you don't have it in stock, but also you are able to keep a close eye on, hey, I really like this product, but I don't so much care for this one.
Exactly.
So I'm going to use this instead.
Exactly right.
Gotcha.
And certainly there is some of the people that we will see buy stuff, whether it's collars, shampoos, some non-prescription items, fish oils, stuff like that maybe not even clients, and maybe we'll get a little business out of that, but that's not the purpose. It's partly for convenience for our clients, partly because we do see them leaving, and then we see a prescription come in, and the biggest thing is there are some unique antibiotic product items like, this dog is sensitive to Heartgard, let's say. We don't carry a lot of the other lines. We just don't have space to carry every heartworm prevention. And then we say, you have sensitivities, we probably should go to this other product. Well, we don't want to stock it. And just for that one or two clients that use it, so we say, okay, we need to go to this other product. You can get it online at our store, and we can ship it to you, and then that way you can get that one item that we don't have on our shelves. So it'll be a nice convenient factor too.
I really enjoy being able to sit in here and listen to you talk about a lot of this because I grew up on a farm, so I'm used to having farm dogs and farm cats and stuff like that. I'm not used to that indoor pet that needs a little bit extra care because farm dogs, you feed them what you buy at Walmart in town, and then it's they get their shots, and if they get ticks or fleas, whatever, you get that taken care of. But otherwise, you're not thinking about all this other stuff that they have to get done. I want to be a dog owner someday on my own, and probably an indoor pet. Don't tell my folks or my landlord that I would certainly love to have those. But I had no idea how much it took into. I mean, it's just the same as caring for any person.
Exactly. There's a huge thing that's been happening. I graduated in '93 from Iowa State and was a mixed practice veterinarian. So I got to see the difference between, and I don't like to say just a farm animal, but it was. I grew up with we had just a farm dog. He never went to the vet for visits. That came out when he was doing some farm thing and maybe gave us shots or maybe Bob was sick. But we were so into the farm that we didn't consider them part of the family. And it's something called human-animal bond, which has been very prevalent in the United States, growing since 2000, since the 90s or whatever, where we want to do more for our pets. Because anymore these days, you see these young couples that get married, they try out with an animal first.
Right, yeah.
Before they do with a baby.
I hear that all the time. Raise a dog first. If you can raise a dog, you can raise a kid.
That's exactly right. And some of them, and then they have both at the same time, which creates its own nuances as far as health. Health of the dog really translates to the health of the child or infant or baby, because you have to worry about intestinal parasites and fleas and communicable disease the dogs can carry to the baby and stuff like that. So you do have a huge human-animal bond, and sometimes they never do have children. And then there's a flip side of that. You get the retirees or the older people that just like to have that dog around since the kids are out of the house and all married with children and all that kind of stuff. So now they're missing the part of their life, which is taking care of somebody else. And those tend to do a very good job of taking care. Now, you still have your across the board. There's still some, it's just a farm cat, Dr. Dan. Right. And that's the difficult thing. And these are some great, again, parlaying, the squirrel sidetrack comments and things to discuss. And that's what makes it very difficult for us veterinarians. And please understand out there, people listening, because I know we have people listening out there that are this is my baby, I'm going to do everything. A $2,000 surgery is nothing. I will do anything because it's my child, and they have the disposable income to do that. And then we as veterinarians, we also have to try to take care with compassion and the full to our abilities, those on the other side of the spectrum. They are on, low-income family. They maybe are just a farm dog, so maybe they don't have the mentality that I don't think I'd do a knee surgery on this dog? Let it have arthritis, which we understand. And we're not judging you. Well, how come you with no disposable income and don't value what a reconstructive knee surgery is on a birth defect versus the one that will do that? There's nothing bad about that. We just have to try to recognize that and do what's best within one, your income, and what's best for two, your philosophy on what that animal is to you and your family and your life or whatever. Is it just a farm dog or is it my four-legged child? So unfortunately, the difficult thing, and this is tailored to the left, if you see my hands in here, the left side, if you're on, you can see this on YouTube, by the way, right? Yeah. So if you YouTube KWPC or
it'd be Voice of Muscatine.
Voice of Muscatine, and look for Dr. Dan. You'll see a bunch. I've been watching a few of them. They're kind of fun. In fact, I got to play my guitar more often. The last one we did actually came off really good.
I mentioned that earlier this morning. I was like, maybe Dr. Dan will bring his guitar again. That was fun.
So I was saying, squirrel, left hand, that low income, low thing, we have to tailor, like Riverside Animal Hospital. We try to have all the equipment. We have lasers, surgical laser, therapy laser, digital x-ray, high-end dental machine, all these things, because we have so many people on the right side that want that $2,000 surgery and do everything because we're going to take care of our animal great, or on the high end of what they have available, and their mental thoughts on what that animal is. So we have to tailor our practice to that. So our pricing, our recommendations, our steps, our protocols, our anesthetic protocol is much more encompassing than maybe that inexpensive, low-cost veterinary practice out there, where the low cost, which can be tailored to those low-income families or low desire families, won't have pain medications, won't have pre-anesthetic blood work, won't have some of the monitoring. They won't have the laser, the therapy laser afterwards. They won't have pain medications go home with you. They won't have a heated table. They won't have a dedicated certified tech and monitoring anesthesia. So they can do $100 or whatever, $150 for that spay or neuter, where we have the high-end stuff, because most of our clients request that, want that. They know what that means. It's like you going to the hospital. How cheap can you do for that surgery for my daughter? No, she had a knee surgery. I wanted the high end. So our quotes, our estimates are based off of the full thing. So if you can't afford that, don't take offense to that. That's just what we do. Let's work with it, see what we can do. If you need to cut some of that stuff out, let's start bringing that down. But we're going to always start with, here's what it costs to do a knee surgery, or here's what it costs to do a spay or a neuter. And it's going to be much more than some of the cheap practices. If that doesn't fit within your budget, let's have a conversation, see what we can do. Because one thing we can't do is, hey, our normal charge is, say, $100 for anesthesia. Well, because you have low income, I can't just charge you $25 for that same thing, because it's, first of all, it costs us way more than that to do that. And it wouldn't be right to, hey, just because you have money, I'm going to charge you more. That's not the way it works. And it's not why we charge. We have nice anesthetic machines and stuff like that, and that's just what it costs to do that. I can't cut that out. The base things have to, but I can maybe not do therapy laser. Maybe I can not do pre-anesthetic blood work, or maybe no fluids. I don't like to do that, but I always start high. So I know that's really gone off from the subject, but that's what I knew was going to happen today. But it's good education for you listeners out there.
Do you want to take a quick moment?
Yeah, let's do that. We'll continue more, and we'll be back. This is Dr. Dan.
Protect your home with Bosch Pest Control. Bed bugs, Asian beetles, spiders, fleas, crickets, termites, moles, and more. Bosch Pest Control uses cutting-edge technology to protect your home from these annoying pests. Call 563-263-7965. Don't squash them, Bosch them.
Here's a look at your forecast from the KWPC AM 860 and FM 95.1 Weather Center. We'll see considerable cloud cover and some developing showers and storms around the area today, with a high temperature around to 80. Winds will stay variable at 5 to 10. Could still see a few showers or a storm early tonight, followed by a low of 65. And then a mix of clouds and sun develops Wednesday, with a high temperature in the mid-80s. Mid-60s Wednesday night, 90 on Thursday. I'm weather meteorologist Paul Frombley. Right now, 70.
Welcome back to Dr. Dan the Animal Man, presented by the Riverside Animal Hospital and Dr. Dan Drehas. Please understand that the views and opinions expressed by the participants of the program are not necessarily those of the management, employees, or advertisers of this radio station. The number to call is 263-8600. And now, back to Dr. Dan the Animal Man.
And we are back, I think. Yeah, this is Dr. Dan, the Animal Man. No, I was just chatting off air with Jordan about, again, that mentality, and it's not a negative thing for me to say that. I don't know the right word. That philosophy on where you place the value in animals, because legally in the United States they are property, which is an interesting thing, and I always thought it was interesting because we as veterinarians, we try to have our cake and eat it too. I'll limit it. They are just property, so they only have so much value. And the proof of that value is on the owner if there's something goes wrong, let's say. But yet we like to say, hey, but they're part of the family and the human-animal bond. They're worth a lot more. Let's try to keep them alive and do good health care. Like our saying is, our goal at Riverside Animal Hospitals is we try to help pets live longer, happier lives, because we want them to be around for a long time with you. And to do that, it goes back to what I was saying right before I went off the air. That's why we make these recommendations. Again, by the way, sidetracking, 263-8600 if you have a question, comment. Doesn't have to be about this, but you certainly can call in for any topic. So when we're in the exam room, and if you're ever at Riverside, and I invite you to come down, we're always taking on new patients. Dr. Stacy's down right now. We had quite a few last month. As when we're saying, hey, we should do this, we should do that, we're doing this, we're really trying to give a good recommendation. Don't take offense to that. Don't think we're money grabbing, because some people will do that. Even like in my emergency center, we try to and expect that, hey, do you want the Cadillac? Because we're going to start off with the Cadillac because that's the best thing for your dog. Let's do some blood work before we do anesthesia. Oh, you're trying to just get money out of me. No, I really would like to make sure that is safe for your dog. Right. Yes, it may cost you $100 more, but I really would like to do that. Oh, we should do the therapy laser afterwards. Oh, you're just trying to get money out of me. No, it helps the healing faster, and I believe in that. I wouldn't do anything I didn't believe as a veterinarian. Absolutely. I think we should clean your dog's teeth. Oh, you're trying to get a procedure on me. No, and was one of my topics I was going to talk about, which maybe I'll push till later. No, the reason we do that is I'd rather clean your dog's teeth instead of extract your dog's teeth in 3 years, and keep that bad breath out. Dental is proven in humans and every species. Tartar leads to bacteria. That's what causes it. As part of the plaque is bacteria. It can lead to heart problems, liver problems, and kidney problems. It's shown in every species. So let's get that out of there and help it to live a longer, happier life. So we're not making recommendations just to get money out of you. We're making that recommendation to keep your pet around longer and keep the teeth around longer. So we're doing these things, and you can always say, I respect it. No, I can't afford it. Whatever. No, it's just a farm dog. And we can understand that too, and that's the difficult thing for us veterinarians to make sure we're satisfying and meeting the desires and goals and requests of the whole rainbow spectrum of just the farm dog. This is my budget versus, hey, it's my family pet with a low budget versus my family pet, and I have more disposable income that I'm willing to do all the safety procedures. So always keep that in mind when you go to any veterinarian. Especially Riverside Animal Hospital, we're going to start off with here's the best recommendations, and we'll try to give you some numbers so we go with that. So anyway, that's a great topic, and this all tailored around, go full circle back to our online pharmacy, where we're trying to help the whole spectrum of people, and that's not even just mentalities and budgets with their animal. That's their life habits. We're getting to the computer age where everybody's online, surfing, Facebook, Twitter, whatever you want to call that, phones, and
can't escape it.
you can't beat them, join them, sort of thing. So you either grumble about, oh, here's another request for an online pharmacy, or somebody came in and say, oh, I just bought that online because I was surfing and it was just easier and they're delivering it to my house. Well, guess what? You can do that for Riverside's. And I just looked up riversidevet.com is our website. Google Riverside. There's one in California too, but the Muscatine one, you'll see our faces. We're updating our website all the time, and now we have a new link that just came up today. In fact, we're having a meeting with the company or the distributor at noon today to kind of help with our staff through that. We've been talking about it, and it's been kind of an ongoing process, getting all our ducks in a row, and there's all these digital financial credit sort of stuff that you have to deal with and make sure everything is applied correctly. And I think what we're doing basically is we're doing competitive pricing for online, so I don't know how that compares to our in-office even, quite honestly. But like I said, more likely will be less expensive just because we don't have to have staff working to do that. We don't have to use resources, printers, bags, bottles, time, and all that kind of stuff. But again, coming to our office and saying at least you ask those questions right offhand and stuff like that. So it's kind of an interesting thing. We're trying out more and more veterinary offices are doing that, linking with their own distributors so that, again, capturing some of those that are going home and seeing. And again, I think a lot of it is convenience. They think it's cheaper, and really it isn't. In fact, it's funny. We've done a lot of the comparison, especially the flea and tick for you out there. If you're listening, and there's a lot of flea and tick products out there, and especially the Frontline, people know that's the big one. I'll say that name out loud because we use those. We like the Mariel. They're now BI, Boehringer Ingelheim. They were bought out a while back. We call it BI because it's a tough German name.
Yeah.
But that company's always made great products. The NexGard, the Frontline, and the HeartGard, the staples that everybody's heard of. But interestingly enough, and here's the dirty secret for you guys out there. If you ever buy online, Frontline, stop. Call your veterinarian. Call Riverside Animal Hospital. Of course, if you look at price comparison, they're going to be cheaper. You know, say 6 Frontline is $100 at Riverside, but it's only $80 online. But if you buy from us, you get 2 doses free. That brings the cost per dose down well below what you get online. Online is not going to tell you that because we have coupons, rebates, and free doses that brings the prices very competitive with online prices. And people don't know that. They just come in, how much is your Frontline? Well, so much for, whatever dose, or so much for a 6-pack. And maybe we need to do better as our receptionists or whatever saying. But if you get 2 doses, that comes down to so much. And people don't calculate in their brain. They just see X dollars versus X dollars. I'm going to buy the cheaper X dollars. Call your veterinarian. Hey, I saw online is this much. How much is your Frontline? Well, this plus 2 doses. It beats them every time. I'll tell you, I've done the comparisons, and I've done it multiple times. We are less expensive. You get $50 rebates. We even get squeaky toys and cups and and things for your animals. They had awesome Yeti cups that we gave away, which are $50, with these nice ones. And if you get like a 12-month supply, so we have perks that onlines don't have. They may be able to beat us by a few bucks, but we have perks and bonuses and gifts and rebates and free doses that almost always on the flea and tick stuff we can very much compete or beat the online prices. So keep that in mind. Plus, you get the guarantee,
right?
Which is always very good. So appreciate that time. We made up for it. And that was a great discussion. Again, riversidevet.com. Check us out. We're updating all the time, and we're pretty proud of the new online pharmacy that we're going to be kicking off today.
That's exciting. So just today that was
it went up. It actually went up last night, and this morning the products went on. So we're gonna, like I say, take some of the ones we don't really promote or don't like as much, and we're gonna work on that through the week. So if you're studying it very quickly, some things may go off, but I don't suppose many people will even notice that. So all right,
excellent.
Thanks, Jordan.
Well, thanks so much, Dr. Dan. It was a real pleasure having you in. As always, we love it when you come in. You're sharing with us here.
We'll talk to you later.
Once again, this has been Dr. Dan on the VoiceOfMuscatine.com.
KWPC K236.